Pain in the groin, pelvic cavity, on the front and inner surface of the thigh, knee, and shin can occur as a result of problems with the adductor muscles of the thigh. In this video, you will learn the causes of the pain, simple exercises that can help alleviate discomfort at home, and useful recommendations to prevent the recurrence of pain. I am Dr. Chernov. Enjoy watching the video. The medial group of thigh muscles includes 5 muscles: the Pectineus muscle, the long, short, and large adductor muscles, as well as the Gracilis muscle. I have already discussed the Pectineus muscle in detail in one of the previous videos. You can find the link to it in the description. And in this video, we will examine the other 4 muscles in detail. Trigger points, or areas of tension located in the long and short adductor muscles, cause pain inside the groin area and slightly above, as well as along the front and inner surface of the thigh. From below, the pain from these trigger points radiates to the front and inner surface of the knee joint, as well as to the shin. The pain intensifies with exertion and during sharp turns in the hip joint. Trigger points of the large adductor muscle are most often located in 2 areas. The first trigger point, which is the most common, is located in the middle part of the muscle and reflects pain upwards into the groin area and downwards along the front and inner surface of the thigh. Higher located trigger points cause extensive pain in the pelvic cavity, which sometimes spreads to the pubic bone, vagina, rectum, and bladder. The pain inside the pelvis can be constant or occur intermittently. Trigger points of the gracilis muscle cause sharp, burning pain along the inner surface of the thigh. The pain persists both during muscle exertion and at rest. Some relief from the pain may be experienced while walking. Chronic overload of the adductor muscles of the thigh can lead to inflammation of the pubic symphysis, tearing of the attachment sites of the adductor muscles, detachment of the periosteum, and even fracture of the pubic bone. Such conditions can occur, for example, in professional runners, dancers, or track and field athletes. Activation of trigger points can also occur during fast horseback riding, skiing, skating, long bicycle rides, or when slipping on ice, where the legs spread apart and resistance is needed to maintain balance. An awkward attempt to master a side split or a skewed kick at the ball during a soccer game can also cause sharp pain. Forced positions, especially in women during sexual intercourse as well as during childbirth, can lead to both muscle damage and activation of existing trigger points. It should be noted that in a number of cases, trigger points in the adductor muscles of the thigh significantly contribute to the overall pain pattern observed when diagnosing arthritis and arthrosis of the hip joint. In a number of patients diagnosed with this condition, there is a significant reduction in pain symptoms when performing exercises aimed at mechanically affecting the trigger points of the medial group of thigh muscles, followed by stretching exercises. There are 2 simple tests that can help detect shortening of the adductor muscles of the thigh. In the first case, during the examination, the patient lies on their back, one leg is bent at the knee joint, and the heel is as close to the pelvis as possible. The doctor stabilizes the pelvis with one hand and uses the other hand to abduct the thigh of the bent leg. If movement is restricted, the foot of the bent leg will be closer to the knee of the straight leg, and the knee of the bent leg will be significantly elevated above the floor surface. The second method of examination is also performed while lying on the back. In the first phase, the examined leg, straightened at the knee joint, is abducted to the side and partially flexed at the hip joint. This movement allows for the assessment of the condition of the posterior part of the adductor Magnus muscle. In the second phase of the test, the leg is lowered very slowly and without jerks, which allows for the detection of stretching limitations in the pectineus, long and short adductor muscles. At home, you can therapeutically affect the adductor muscles of the thigh by rolling them on a large massage roller, followed by stretching. To do this, take the roller and lie on your stomach. Bend and abduct one leg at the hip joint. Position the roller perpendicular to the thigh. Move your leg to the right and left for several minutes. If you find an area of tension and intense soreness, stop there for 30 seconds, applying strong mechanical pressure. For a more localized and deeper impact on the area of trigger points, you can also use a large massage bowl. If these exercises are difficult for you to do on your own, ask a close person for help. They need to press down on the leg from above and move it to the right and left, shifting the massage roller from the groin area to the knee joint. Be careful with the pressure, as the pain can be very intense with problematic muscles. After performing the same exercise on the opposite leg, you should proceed to stretching the adductor muscles of the thigh. Since the main function of all the medial thigh muscles is to adduct the thigh, they can be stretched by abducting the thigh. Sit on the floor, bend your knees, and bring your feet together. You can lean your back against the wall, grasp your feet with your hands, and bring them as close to the pelvis as possible. try to lower your knees down as much as possible. Hold the final position for 1 to 3 minutes, combining it with deep and calm breathing. With every fourth exhale, try to lower your knees even further. You can ask someone close to you to very gently help by pressing on the knee joint area with their hands. After completing this exercise, slowly bring your thighs together and sit in this position for a few seconds. Then take a strap, make a loop, and lie on your back. Bend your leg at the knee joint and loop the strap around your foot. Then straighten your leg. Do not lift your head off the floor. Gently pull your leg towards you, and then to the side. Do not allow your pelvis to lift off the floor. When performing this exercise, you can also use assistance. Maintain deep breathing, and with every fourth smooth exhale, try to move your leg even further. Hold the final position for 1 to 3 minutes. Then slowly return your leg to the starting position and repeat the exercise on the other side. The next exercise, which helps stretch the adductor muscles of the thigh, is performed while sitting. Spread your legs as wide as possible and place your hands in front of you. Without rounding your back, try to tilt your pelvis slightly forward, feeling the stretch in the inner thighs. Hold this position for 1 to 3 minutes. A similar exercise can be performed near a wall. Sit sideways near the wall and lie on your back. Turn and press your pelvis against the wall. Gently spread your legs apart and achieve a stretch in the inner thighs. You can slightly assist yourself with your hands, applying additional pressure. Hold the final position for 1 to 3 minutes, maintaining deep and calm breathing. Then slowly bring your legs together and return to the starting position. Another effective exercise for stretching the adductor muscles of the thighs is as follows. In a standing position, place your feet wide apart and bend them at the knee joints at a 90-degree angle. Perform several dynamic squats. Then lean your torso forward. Push off your legs with your hands and hold this position for 1 minute. If you are troubled by the pain described in this video, in addition to the demonstrated exercises, you should also pay attention to your sleeping position. To prevent prolonged shortening of the adductor muscles of the thigh, place a pillow between your legs while sleeping on your side. Your legs should also not be too bent at the hip joints. When you are sitting, do not cross your legs or place one leg over the other. When sitting in a chair at a desk or in a car, avoid positions with sharp bending of the hips. I would be glad if you share this video with your friends and loved ones who suffer from groin and hip pain. Also, watch the video about the highest located adductor muscle of the thigh, the Pectineus muscle, which causes pain in the groin area, hip joint, and along the inner thigh. Stay healthy, and see you in the next videos.